Hi everyone, welcome to our presentation on social innovation. This project is for Entrepreneurship 301. The presentation was completed by Allie Bishop, Kendall Burt, and myself, Emily Tatum. Social innovation is about creating new social structures that allow issues of justice, education, environmental protection, sustainability, and/or community development to be reframed so that new solutions can come forward. Social innovators question the premises on which existing social structures are built and then reimagine systems and institutional relationships to bring about change. So what is social innovation? Social innovation is the process of developing and deploying effective solutions to challenging and often systemic social and environmental issues in support of social progress. For a further explanation, Stanford Social Innovation Review describes social innovation in this way. Social innovation is helping to solve some of the world's most pressing problems with new solutions such as fair trade, distance learning, mobile money transfer, restorative justice, and zero-carbon housing. In the process of creating new solutions, it is also profoundly changing beliefs, basic practices, resources, and social power structures. Social innovation provides a unique opportunity to step back from a narrow way of thinking about social enterprises, business engagement, and philanthropy, and to recognize instead the interconnectedness of various factors and stakeholders. A few popular examples of social innovation programs include homeless shelters, fair trade organizations, poverty assistance programs, and farm-to-table movements, but there are many more. Innovation comes when a need is identified as being unmet and an idea is formed about how the need could be met. The goals of social innovation are to meet needs, empower people, promote change, and solve social injustices. History of social innovation. The idea of social innovation seems to emerge in the early 20th century. Towards the middle of the 20th century, you can see a rise in the use of the term as well as a small change in what social innovation includes. With this said, social innovation is not a new concept. Since humans have existed, there has been an urge to make existing situations better. However, people have not always referred to this concept of improvement as social innovation. Social innovation keeps re-emerging with a slightly different meaning. Social innovation became another word for already established solutions to social problems or needs, such as technological innovation or social reform. According to Jeff Mulgan, who wrote The Process of Social Innovation, the most important innovation over the next few decades will follow patterns of social innovations rather than the patterns in the traditional sectors such as information technology. The three categories of social innovation that we will be discussing with you today are healthcare, politics, and education. First, we will be discussing social innovation in education. Technology is the first social innovation in education. Title I schools require students to have technology available to them. According to the Department of Education, this program provides financial assistance through state educational agencies, called SEAs, to local educational agencies, called LEAs, and public schools with high numbers or percentages of low-income children to help ensure that all children meet challenging state academic content and student academic achievement standards. Title I reaches about 1.5 million students enrolled in both public and private schools. Title I funds may be used for children from preschool age to high school, but about 65% of the students are in grade 1 through 6, and another 12% are in preschool and kindergarten programs. Title I is designed to support state and local school reform efforts that are tied to the challenging state academic standards in order to reinforce and amplify efforts to improve teaching and learning for students that are furthest from meeting the state standards. Individual public schools with poverty rates above 40% may use Title I funds along with other federal, state, and local funds to operate a school-wide program to upgrade the instructional program for the whole school. Schools with poverty rates below 40%, or those that choose not to operate school-wide, offer a targeted assistance program in which the school identifies students who are failing or most at risk of failing to meet the state's challenging performance standards, then designs, in consultation with parents, staff, and district staff, an instructional program that meets the needs of those students. Both school-wide and targeted assistance programs must be based on effective means of improving student achievement and include strategies to support parental involvement. Technology makes learning more accessible when students aren't in the classroom. The increasing speed and availability of internet access can reduce many of the geographic constraints that have disadvantaged students in the past. Students can now access online videos that provide instruction on a wide variety of topics at various skill levels and participate in real-time video conferences with their teachers or tutors that are located in different states or even different continents. Technology also allows for personalized learning. Advances in artificial intelligence technology now allows teachers to differentiate instruction, providing extra support and developmentally appropriate material to students whose knowledge and skill is below grade level norms. In addition, technology allows students to be prepared for what they will be expected to know when they enter the workforce. We live in a world that runs on the ability to use technology. Businesses utilize Excel, email, QuickBook, and many other programs in their daily activities. Students that don't receive a secondary education may not have any experience with exercising these skills if they aren't introduced to technology at some point during their primary education. The Journal of Information of Technology Education notes that employers are finding that their applicants have good soft skills but do not have the hard skills that they need in order to be successful. Hard skills are skills like being able to use technology, and soft skills are skills like empathy and communication. If you look at these statistics, there is a variety of information regarding how students and teachers view and utilize technology. I will be discussing a few of them with you now. 70% of universities use an automation system that is similar to what we use here at Western, called Blackboard. Systems like these allow students to be more organized, keep track of their grades, and encourage productive behaviors. 81% of teachers think tablets enrich classroom learning. At this point in time, people are attracted to technology. Students may be less distracted and more involved if they are using what they are interested in. 49% of students say that it helps them save time. This may include the ability to do research and access information quicker, check emails, contact teachers and other peers for help outside of the classroom. 65% of students say that technology helps them feel better prepared. Technology allows students to access a variety of study tools, exercise different learning styles, and get things done more efficiently. Partnering with community colleges. Dual enrollment enables high school students to take college courses so that they can develop successful habits of college students and go through actual college experiences that build momentum toward a degree or credential. Many high schools partner with community colleges to offer an associate's degree along with their high school diploma. This allows students who do not have the financial resources to further their education after high school a comparable opportunity to those that do. Furthermore, the Department of Education describes dual enrollment as within an organized system with special guidelines that allows high school students to take college-level courses. The guidelines might have to do with entrance or eligibility requirements, funding, limits on course taking, and so on. According to the Community College Research Center, nearly 2/3 of community college dual enrollment students nationally were from low or middle income families, about the same proportion of students who start in the community college after high school. Now we will discuss social innovation in healthcare. Like most industries, there have been major advancements in healthcare over the past few decades. When I say this, your mind probably goes to scientific discoveries and new technology, such as the 3D pill and robot surgery. However, many advancements are concepts that benefit society as a whole. It is predicted that over the next 20 years, the biggest growth for national economies will be in healthcare and education. Some examples of current social innovations in healthcare include hospice, which was created for individuals to have quality end-of-care life and to reduce the stress on hospital resources that is needed to support medically complex patients. Second is holistic medicine, which empowers people to live a balanced life and reduce the need for prescription medication. Third is telemedicine and helplines. Sources like this could include WebMD. Here you can communicate with doctors and get a potential diagnosis from home. Fourth is remote patient monitoring and wearable technology. These allow doctors to see how your body is functioning without needing to be with you in person. Fifth is patient portals, which allows patients to keep track of their records and become more educated about their health. And lastly is self-help health groups. Here you can identify what you're struggling with, connect with others, and receive support from trained professionals. This is great for people without easy access to therapy or those who lack insurance. It is rare for new social ideas to be inherently new in themselves. Most ideas are a combination of and/or repurposing of existing products, services, and ideas. For example, mobile pay on your phone was a thing, and car services such as taxis were a thing. Uber was a social innovation that combined the two and has made a substantial impact on our society. Most of the great ideas in society straddle different disciplines and industries, and healthcare innovations are no different. One of the most notable social innovations in healthcare is the creation of the diagnostic helpline. These helplines combine telephones, the internet, nurses and doctors, and diagnostic software. None of these are brand new concepts, but the combination puts patients at ease and reduces the cost of unnecessary medical visits for doctors' offices and patients alike. Social innovation is important and beneficial in every environment, but it is needed more in some places compared to others. This is especially true for socially innovative healthcare. Rural areas will get the most benefit from advancements in healthcare. Living Goods is a non-governmental organization that has helped reduce the childhood mortality rate in Uganda by 27% between 2011 and 2013. They do this through low-fee private delivery of healthcare, the use of mobile phone applications to diagnose symptoms in the field, and by administering tests and drugs to treat malaria, diarrhea, and pneumonia. The cost of their services is less than $2 per person. The company uses a unique model where they train individuals for 2 years and hire them as independent health agents as opposed to employees. This is similar to the Avon and Tupperware sales models, but they are offering health services instead of selling products. They also benefit their local community by training individuals who are previously unemployed. These people have since brought back more than $4 million in salaries when they returned from Uganda. The project tackles the problems of finding volunteers for impoverished communities, the lack of supervision, and a poorly stocked supply chain. One Family Health developed a community partnership in Rwanda to establish nurse-run health posts. 90 posts have served over 500,000 people. A rural health plan was established in Wales by the Welsh Assembly government due to a rural health deficit. In Wales and other rural places, including areas of the U.S., access to and integration of health and social services is necessary for the future of communities. Socially innovative and sustainable solutions are the answer. Disruptive social innovation will be the future of healthcare. Something that is developing quickly is the ability to have doctor-patient communication anywhere, anytime. This is referred to as asynchronous medicine. Patients will be able to receive care without being in the same room or even the same time zone as their doctor. Home diagnostic devices already allow patients to communicate their blood pressure, blood sugar, and weight to their doctor, among other things. Diagnostic imaging is following a similar path. Have you had an X-ray recently? More than likely, you interacted with a technician and your images were sent to a licensed radiologist in a different location for their diagnosis. Smart bandages are being developed to cover chronic wounds, such as burns or diabetic sores. They are able to detect the pH levels and temperature of skin to determine if there is an infection. They also have built-in heat elements that will be able to administer the appropriate medications to the wearer. The bandage is being designed to assist the natural healing process, and they will reduce the number of hospital visits needed for these chronic conditions. Innovations in healthcare are beneficial to society. Some of them reduce the cost and time for care providers as well as patients, and they allow more access to healthcare than previously available. However, there are some constraints to implementing these innovations. Some concepts may be too expensive to implement, especially when the existing solution doesn't seem to be a problem. I once worked at a small doctor's office that did not want to switch over to electronic medical records even though it was easier for patients to access them. For the office, it was time-consuming, complex, and would cost them thousands of dollars to hire someone to transfer the records. They were small enough to keep paper records until they were forced to switch by new laws. However, there were some unforeseen side effects that made the process more difficult. People's records would get mixed up and no one could decide whether new records or past records should be entered into the system first. This made the new innovation frustrating for everyone in the office. Sometimes it is not the right time to implement a new idea, and if the idea is a preventative solution, it will take longer to adapt to. Most innovations are solutions to a symptom of a problem, not a solution to the root cause. Solving a root cause takes much more change, which requires more time and money, so it is harder to get people to implement these ideas. Speaking of people making it difficult to implement ideas, let's move on to social innovation in politics. Social innovation via politics. Politics are becoming more reliant on technology and media. Media and other technological innovations change the way politics influence our lives and impact society as a whole. When moving into the 21st century, it also meant that we were moving into the minimal effect era. In the early 1900s, public opinion was a constructed, manufactured thing which could be shaped and manipulated by those with an interest in doing so. There was a rise of a new professional class of press agents who worked for political organizations and media institutions whose job it was to influence public opinion. The accessibility of news sources has grown tremendously over the past 70 years. Since the 21st century, the trend of public opinion mattering has advanced with the rise of technology and social media. Media and politics. Start with the 1960s. The assassination of John F. Kennedy is one of the events that changed the news media forever. News executives had to figure out a way to get live video, film, and still photographs from the scene in Dallas, Texas, to be able to convey it to the nation. Due to the lack of fast communication systems, the news being played for Americans about the Vietnam War was days behind. 1970s. Live events began to be covered, such as ribbon cuttings. In the 1980s, news organizations wanted to make their viewers' lives better, so they started to include health and consumer reporting to help people live longer and save money. Computers were introduced to newsrooms. This made everything easier, from finding old stories to finding phone numbers. In the 1990s, new networking shows that were cheaper options began to emerge, such as Dateline NBC and ABC's Primetime Live. News organizations developed their first email systems and websites to communicate with the public in a new way. Then the 2000s. After the attack on 9/11, news broadcasters found themselves having to announce bad news but trying to reassure viewers simultaneously. Watching the news is a thing of the past. There are so many new ways to receive news other than sitting in front of the TV today. It is rarely convenient for someone to actually choose this form of news consumption, when most everyone has technology at their fingertips. Cell phones take off and advance technologically each year. Cell phones are used for so many different forms of communication and ways of receiving information. Social media emerged and is being used by most Americans today. In fact, most Americans today receive their news off of Facebook. Technology is used for a variety of different things in political systems. The first is polls. Political scientists use online polls through social media, websites, and email to conduct public polls and surveys. This allows an easy, cost-efficient way to know what the public is thinking and feeling. Second is advertisements. Political and campaign advertisements are everywhere today. On TV, social media platforms, pop-up ads, sponsor websites, and more. This allows politicians to reach everyone with their message. There are many forms of communication. Technology is key for communication today. Politicians connect with their peers, their constituents, and their public through email, text messages, video recording, social media, online chats, online newsletters, and more. There's also voting registration. Available in most states, a convenient click of the button will allow citizens to become registered voters. Lastly, there's news. News has become more convenient to the American people. It is now at your fingertips. There's no more waiting for the news to come on at 6 o'clock or waiting for the newspaper to be delivered. Technological social innovations can have positive and negative effects on political communication. Some of the pros are quick communication. This could be from legislators to the public, news media to the public, government to the public, or even public to public. It's also a time saver. Political news and communication spread extremely fast. Anyone with access to the internet has the world at their fingertips. A single Google search can take seconds and provide you with thousands of results. News is also easily accessible. Technology gives everyone an easy way to access the news. This benefits everyone who does not have the time to watch cable news or doesn't have access to it. Technology is also cost-effective when it comes to viewing political dialogue. If you have a TV, computer, phone, tablet, or whatever, you can access the news and save some trees while you're at it. There's also less effort for the consumer to come across news. You can consume the news in the comfort of your own home at any time. There are also cons. Some of the cons are that with technology, there's less person-to-person communication due to the fact that technology is so convenient and we can access it at any time. Technology provides a lot of distractions with links and other news, ads, messages, and more. It can also provide an overwhelming amount of information where we don't know what to take in. Technology produces a larger chance of citizens consuming fake news, which isn't published by a trusted news source. It also takes away the personalization of contact. Therefore, there is less actual representative constituent communication. Political polarization is the vast and growing gap between liberals and conservatives, Republicans and Democrats. It's a defining feature of American politics today, and one the Pew Research Center has documented for many years. Congress is more polarized today than ever before. Extreme polarization began in the 80s during Ronald Reagan's presidency due to the media, the public's political ideology, and redistricting. The people on the extreme ends of the spectrum have a greater impact on the political process than the ones with mixed ideological views. Polarization prevents compromise and reduces the chance of legislation being passed in Congress. This makes it difficult for the American people to feel satisfied, their needs to be met, and their voices to be heard. As you can see on this graph, the amount of women in Congress has been increasing since the 1990s, and there is a growing increase in racial and ethnic diversity in Congress. The current Congress is the most racially and ethnically diverse ever. Non-whites account for 22% of the Congress and 25% of the House of Representatives, compared to only 1% in 1945. There are 14 foreign-born citizens in today's Congress. Women in Congress is at an all-time high, with 127 women there today. Just a little over a century ago, the first woman, Jeannette Rankin, was elected to Congress. Although our Congress is more diverse than ever, Congress does not have an equal demographic representation up to the people. There are many people working hard every day to make America a place of total equality, knowing that we are still far from it. Having a demographically diverse representation is extremely important so that all Americans are heard and have equal opportunity. Diversity also brings a number of perspectives that have not been heard or represented in the past. And that concludes our presentation on the future scanning of social innovation. If you would like to learn more about social innovation, please copy this link below and it will take you to a 16-minute video explaining what social innovation is and what is happening in the world of innovation right now. I hope you enjoyed. Have a great day. Thank you.